The situation of MS in Malaysia currently is that there are more neurologists now who are trained, who recognize the signs and symptoms of MS. We have also got more neuroradiologists who are able to better interpret the scans, as well as lab facilities to diagnose and differentiate this particular disorder from other disorders. However, because of the cost of the drugs, so this makes it difficult to support a higher number of patients. So a lot of patients get support from the public sector. However, there's a ceiling effect because after a certain number of patients are able to be supported, then the remainder patients may have to look for support elsewhere. So we still have a large number of patients who are self-paying, and when it comes to self-paying patients, naturally cost is a big factor. They're fearful about being a burden to their families. They're fearful about whether the cost of the drugs will impact on their ability to be continually employed, especially if they're supported by their employers. And definitely the fear of constantly whether they'll be able to sustain the cost or whether they will be supported in terms of continuous supply of the drugs, that definitely has an impact on their psychology. More patients are able to access the off-label treatments because the cost is very much lower compared to the on-label treatments. If the drug is priced at a more reasonable pricing, where more patients can access it, then you have more patients who are able to get onto treatment. I'm very glad that we had this opportunity to have sessions with the MSIF. Over the last couple of years, this kind of work and exchange has actually borne fruit. Locally now, we have, just of this year, for the first time, 2 drugs that are available on the essential medicine list for MS. And hopefully that creates an avenue where patients with MS are able to access these drugs at a more cost-effective manner, not only for the patients, but also for the public sector in trying to provide access to more number of patients locally.